Hello my people, welcome back to my channel. Today I want us to discuss about something very important, and that is diabetes. Quite a number of new cases that I've been witnessing in our facility nowadays, if not every day, is about new diagnosis of diabetes. A lot of people come with signs and symptoms they have been ignoring for quite some times, only to find out that it is diabetes. Others come with very serious complications of diabetes, such as blindness, numbness, diabetic foot, chronic wounds. And that one has made me to discuss today about what is diabetes, the warning signs of diabetes, what are the complications of diabetes, and how else should people who have already developed diabetes should live. What are the risk factors? Stay with me until the end of the discussion, and if you're new here, please consider subscribing, liking our content. Now, what is diabetes? Diabetes is when the amount of the sugar or glucose level in the bloodstream is quite high than required. Remember, glucose is the main source of energy for our body. There is an hormone called insulin that is produced by pancreas, that its work is to ensure that there is movement of glucose from our bloodstream to the muscles, where the glucose is needed for the functioning of our body. Now, continuous accumulation of that glucose in our bloodstream leads to damage, or leads to great damage of most organs of our body. Now, what are the types of diabetes? Number one, we have type 1 diabetes, and this one begins in childhood or young adulthood. Here, the body produces little or no insulin, and for this one, people have to survive with insulin injection for the sugar balance through their life. Number two, we have type 2 diabetes, and this one is the most common. Here, the body produces insulin, but there is resistance, or the body is not using the insulin properly due to the resistance from the masses. This one is slightly associated with overweight, inactivity, family history, poor eating habits, and increase in age. Number three, we have gestational diabetes. This one occurs during pregnancy and it improves after delivery, but it increases the mother's future risk of getting type 2 diabetes. What are the warning signs of this diabetes? Number one is frequent urination, excessive thirst, blood vision, frequent urinary tract infection, frequent yeast infections, tingling and numbness of the upper and lower limbs, slowed wound healing, and many more. Now, what are the risk factors of this diabetes? Number one is family history of diabetes. Number two is gestational diabetes, or rather diabetes in pregnancy. Number three is sedentary lifestyle and poor eating habits, no exercise, and such like. And the next one is increase in age, high blood pressure, and also high cholesterol level. Now, what are the complications of this diabetes? Now, if diabetes is poorly controlled, it affects almost all the body organs. If it's the eyes, it causes blindness. If it's the kidney, it may lead to kidney failure. If it's the brain, it may lead to stroke. And if it's the nerve, it may lead to nerve pain. It may lead to loss of sensitivity, which is very dangerous. And if it is the limbs, the upper or the lower limbs, due to loss of sensitivity, it may lead to chronic ulcer or the chronic wounds, which may lead to amputation and many more complications. Now, can diabetes be prevented? Okay, with diabetes type 1, currently no. It's because the body is the one having an issue of producing little or no insulin at all, making it difficult to balance the sugars, and now the person has to depend on artificial insulin injection every day to balance the sugars. But with type 2 diabetes, something can be done to prevent. And number one is nutrition. You have to consider what you're taking and at what time are you taking this food. For example, you have to avoid a lot of sugary foods. And number two, you don't have to take a lot of high amount of food portion where you are not active. And it's advisable you take your food when you are very active, maybe in the morning you take a large portion, and maybe in the afternoon, and maybe in the evening quite a little portion of your food, because you are going to sleep and therefore you don't need a lot of energy or a lot of sugar. Number two is exercise. Exercise is what makes your muscles need a lot of sugar, and in turn this one will activate your insulin hormone to channel the sugar from your bloodstream to the muscles and therefore help regulate the sugar level. And next is avoid substances like alcohol consumption and cigarette smoking. And if you have already been diagnosed with diabetes, here are the basic simple rules to adhere with. Number one is medication. Always take your prescribed medication as prescribed by your doctor. Number two, never stop your medication just by feeling better or by feeling like you feel like stopping without consulting your doctor. Number two, it's exercise. Take every 30 minutes of your day to do an exercise, just to sensitize your muscles to take glucose from your bloodstream. And a minimum of 150 minutes in a week. And next, please take care of your feet. Always inspect your feet for any wound. Don't put too tight shoes or closed shoes, because they may lead to leg ulcers, which may complicate and lead to chronic wounds. And finally, it is about nutrition. Always take your prescribed meals and always consider the time your nutrition has advised you to take your meals. And above all, always avoid sugary foods and avoid substances like alcohol, which may further damage your pancreas that is already has issues in producing insulin. Next, I want us to talk about hypoglycemia or low blood sugar. This often happens to people taking insulin injections or some diabetic drugs, and they present with confusion, dizziness, fast heartbeat, and sweating. So if they are able to communicate and they are oriented, please quickly prepare for them something sugary. It can be a drink, and follow it up with a snack or a meal. And if they are unconscious, please seek an immediate and urgent emergency care. And let's talk too about high blood sugar. And this often happens to people with diabetes. So it presents with extreme thirst, frequent urination, blood vision, and some confusion. And it might be a complication of diabetes if it presents also with vomiting, severe dehydration, and this can be an emergency where you need also supposed to look for an urgent emergency care. Next, let me address some myths about diabetes. That thin people do not get diabetes, which is not true. That if you take a lot of sugar is when you get diabetes, not true. And if you have been taking your diabetes medications and maybe your sugar stabilizes, that you are supposed to stop your medication immediately, that is very dangerous. It's not true. And that diabetes can only be cured with herbal and traditional solutions, which is not true. Always consult your doctor. Finally, diabetes is very common, but it doesn't have to control your life. By strictly following health habits, early diagnosis, and strictly following your healthcare provider advice, we should prevent diabetes and diabetes complications. And if by any chance you have ever experienced the signs and symptoms that we have discussed about, please consider going for a checkup. Thank you for your time, and if you're new here, please consider subscribing, liking, and sharing our content.